All right, my name is Michael Overstreet. I'm here today with Daniel Gates. He is the Medicare expert. Medicare season is upon us, open enrollment is upon us, and we know that there are lots of questions when it comes to Medicare. We are going to answer all those questions for you today. Make sure you are educated and aware so that you can make the best decision for your healthcare. So, as I said, this is Daniel. He's our expert. We are going to go down the list of questions and he is going to fill us in and let us know. So the first thing, Daniel, what is Medicare?
Medicare is health insurance that the government provides once you turn 65 or if you have a disability before the age of 65.
Okay, so with that being said, who do I buy Medicare through if I'm eligible to buy Medicare? Because I know it's a government program, but I also see different commercials and advertisements on TV from different companies. So who do I buy it from?
So Medicare has a couple different parts. If you're on original Medicare, it's just part A and B. There's A, B, C, and D of Medicare. A is going to cover your hospital visits, inpatient. Part B is going to cover doctors. Part C is going to be what we primarily do and what you do with private insurance companies, where it's supplemental insurance or Medicare Advantage. And then Part D is going to be prescription medications.
Okay. And so tell me where I buy those from, each part.
Okay, so Part A and B, you get those when you turn 65, and you can register for that with the Social Security Administration. Once you have your Medicare card, you can apply for a supplemental insurance plan or Medicare Advantage plan with any of the big private insurance carriers. This would be someone like United Healthcare, Humana, Cigna, Aetna, any of those big ones. They do offer coverage that pairs with Medicare to give you additional benefits.
Okay. So if I'm understanding correctly, A and B is something that comes from the government.
Correct.
Everything after that is basically adds on top of that, and you buy that through the individual companies.
Correct.
Okay. So when I turn 65, am I automatically enrolled into parts A and B by the government, or do I have to do something? Explain to me how that works.
Most of the time you're enrolled automatically into Part A. Part A doesn't typically carry a premium. Part B is the one that most of the time you have to go and enroll in yourself, which does carry a premium. Everybody who's on Medicare pays the Part B premium.
Okay. And is that Part B premium the same for everybody?
Yes, I believe this year for Part B, it's about $142 for Part B for 2021.
Okay. And is that paid? How do I pay that? Is that something the government automatically takes from my Social Security?
You have a couple ways to pay, a couple options. The most common one is people just have it taken out of their Social Security.
Okay.
You can also choose to get like an invoice in the mail and pay it that way. But the majority of people just pay through Social Security.
Okay. So Part A, I'm automatically enrolled in, and there's no premium. Part B, I'm not automatically enrolled in.
Correct.
Okay. And then for everything after that, we're paying the premium to the company.
Yes.
To the private company. Okay, so we know there's parts A, B, C, and D. If you could go into a little more detail and explain what the difference is between all of those.
Okay. So Part A of Medicare is going to cover hospitals, inpatient services. Part B is going to cover doctors' services. And combined, Part A and B make up original Medicare.
Okay.
Then we have Part C, which is going to be Medicare Advantage and supplement plans. They call it Medigap. And then Part D is for prescription drugs.
Okay. So if you want the full broad, you want to be covered for everything, you need to buy, well, you already have A and B through the government, but you need to buy C and D from a different carrier.
Correct.
Okay.
Yep. Now, when you are on original Medicare, just A and B, you can still get a Part D, prescription drug coverage, because original Medicare does not have that.
Okay.
So most folks, if you don't have a Medicare Advantage or supplement plan, and you're just on original Medicare, you have A, B, and D.
Okay. So you don't have to have C to have the D.
Correct.
Okay. Very confusing. That's why Daniel's here. He can walk you through all of it. And I understand, if I understand correctly, we're being kind of broad, but there are a lot of different factors that can change things a little bit.
Correct. Yeah, it's a little bit different for each person. The rules are the same across the board, but different circumstances make different rules
Okay.
apply.
Okay. So if you're confused by it, really, you just need to talk to someone like yourself.
Yeah,
To
talk to someone who
it.
knows Medicare, and they can help you out with it.
Perfect. Okay, so I know that a lot of questions that people have who are age 65 and older is, well, I want to go to this doctor. I've been going to this doctor forever, or I really like this doctor, or maybe I'm traveling or whatever. So how does that work? How do I know if my doctor takes Medicare? Do generally all doctors take Medicare? How does that work?
So most carriers, about probably 95%, take Medicare and use that Medicare network. Once you switch to, say, a Medicare Advantage plan or supplement plan, then it's going to change a little bit. If you're on a supplement plan, you still use the original Medicare network. So same doctors, you can go across the country, different state, doesn't matter. As long as they take Medicare, you're fine. If you do a Medicare Advantage plan, Medicare Advantage has two different kinds of plans. They have what's called an HMO, which is in-network plan. So you do have to utilize, say, Cigna's network. And they also have a PPO plan, which utilizes both in and out of network. So when you have a Medicare Advantage plan, you do have to utilize that carrier's network, unless it's a PPO, which allows you to go both in and out of the network. It's cheaper to stay in, but you can go out of the network as well.
Okay. So when you're helping someone find a plan, are you able to let them know which doctors are in that specific plan's network and which aren't?
Yes.
Okay.
So you're able to look up your doctors with each different carrier. They each have a list of their doctors, and you can see and make sure that your doctor is going to be covered before you purchase one of those plans.
Okay. So that's probably a very important question. One of the most important is my doctor on this plan?
Yes, doctors and medications.
Okay.
Always got to check those.
Perfect. So speaking of plans and changing plans, when can someone change Medicare? Can they just middle of the summer say, I don't like this plan, I want to change, or how does that work? When can someone change their plan, if at all?
Yeah, so with original Medicare, there's no plan to change, so you don't need to worry about it there. When you're on a supplement plan, just the supplement, you are able to change anytime.
Okay.
That would be if you are already on a supplement plan or had just original Medicare. If you had a Medicare Advantage plan, you do have to wait until the annual enrollment period. And this is October 15th to December 7th every year. And that does apply for both Medicare Advantage plans and prescription drug plans.
Okay. So you've mentioned a few times Medicare Advantage and Medicare supplements. Can you tell us the difference between what those two are?
Yeah, the primary difference between them is, think of an employer's plan. So when you were working and you had coverage through your employer, that kind of coverage is what a Medicare Advantage plan feels like, where you have copays for the different services that you go and get. So if I need to get x-rays, I have a copay. If I needed to go see my doctor, there's a copay.
Okay.
So that's what a Medicare Advantage plan is similar to. However, Medicare Advantage plans don't typically have a premium. If they do have a premium, it's very low. So you're looking anywhere from no premium to the most I've seen is about $70 a month. But the bulk of them do not carry a premium.
Okay.
A Medicare supplement plan does have a premium each month. It's typically higher, somewhere between $200 to $300 or so, depends on the individual. But when you go see your doctor, there's really no fees. So if I need to go see my doctor, it's already paid for. If I need to go get this service done, it's already taken care of. So that's going to be the primary difference, whether I want to pay for the services as I use them or be paying higher each month, but then when I go to the doctor, I don't have to pay anything.
Okay. So it seems like more and more people are working past the age of 65. They have their own medical plan, either a private plan that they purchase themselves or through their employer. So when someone turns 65, if they already have good coverage and they don't want to go on Medicare, do they have to? Or how does that process work?
So if you're still employed, if you're still working, you can defer your Medicare enrollment without any penalties. So let's say you're still working till you are 68. Mm-hmm. That's fine. You can defer Medicare until you are retiring from that job, and then you can go ahead and apply for Medicare and get enrolled in Part A and B.
Okay.
You can enroll in Part A of Medicare before you retire, since a lot of people will do that because it doesn't typically carry a premium.
Okay.
And then the Part B, people will typically wait for to enroll once they retire.
Okay. So they could technically be enrolled in Medicare Part A and still have their other coverage.
Correct.
Okay, and there's no problem with that.
Correct.
Okay, so I can see how some people might get confused because Parts A and B is through the government, Part C and D is through a different carrier. So if and when someone has questions on their Medicare coverage, who should they call?
So you can always contact Medicare directly at 1-800-MEDICARE. You can contact your local Social Security office, administration office, and they can give you a hand. You can also contact one of the carriers directly or a local broker or agent.
Okay. And I know, and if you're watching this because you have questions about Medicare, that probably means you're 65 or close to 65 and you've probably gotten tons of mailers and phone calls and solicitations. So you've probably been overloaded. A lot of those people are coming from call centers to where you get a different person every time. I can see the value, and Daniel, you've probably seen this in a local person that you can sit down with. You actually allow people to come in, sit down with you, talk with you, and walk them through the process.
Yeah, it makes it a bit easier to work with the same person each time, both for the person helping you and for yourself, because then you already have someone you know, you trust, they know your situation, you don't have to repeat it over and over again.
And you're happy to, let's say one year someone goes with this plan, but then the next year circumstance change and they maybe need another plan. You're happy to sit down with your clients every year and make sure they're in the best plan for them.
Absolutely. Every year we can revisit those plans, see if because every year there's new plans coming into the area, and it's by zip code primarily. So each year there's new plans. We can look them over again, see if one makes more sense than the other, and switch you over.
Thank you, Daniel. Appreciate it.
You're welcome.
And we'll put all of Daniel's contact information down below, website, phone number, so you can reach out to him if you need any help or have any questions. We're always happy to answer those questions. Thanks for watching, guys.